Now we start with the latest on the coronavirus situation in South Korea. The number of new infections are ticking up, a factor authorities are chalking up to in the aftermath of the three-day long weekend.
Yeah, for more on this and other COVID-19 related updates, I'm glad to say we have live in the studio our reporter Shin Ye-eun. Good morning.
Good morning to you both.
So let's start with the forecast for Wednesday. Generally speaking, the official tally comes out at around 9:30 a.m. But as far as estimates for the tally, how's it looking thus far?
Right, so one thing we definitely know now is that Wednesday's number of new cases will be higher than of yesterday's. And from midnight to 9 p.m. Tuesday, 1,471 people were confirmed to have contracted the virus. This is 197 more than what was reported on the same day at the same time on Monday. Now, officials expect Wednesday's caseload to be around 1,600. Now, while this is a drop from the same time last week when cases neared 2,000, authorities say it's important to keep monitoring closely throughout the week, especially because people are just coming back from a three-day weekend. Among the locally transmitted infections, around 3/4 were from the Greater Seoul area.
Now, Yeun, from this Friday, South Korea is set to change its virus prevention measures so that it goes in line with the living with COVID-19 system. And authorities plan to ease this social distancing measures so we can return to our daily lives, regular lives, right?
That's right. With the current social distancing measures to end on Sunday, authorities will be announcing the new guidelines on Friday, and these will be implemented from next week. While they didn't specify the exact guidelines or how the measures will change, they did mention it'll probably be the last set of guidelines before they switch to the new strategy. Take a listen.
From next week, the social distancing guidelines will probably be the last adjustment before we switch to the living with COVID-19 strategy. As of now, we are thinking of easing quarantine measures, mainly for those who've been or will be vaccinated.
So you can see that the vaccination is a key part of the government trying to gradually return society to everyday life, and that's why many are expecting there will be some type of incentives for the fully vaccinated. Even now, authorities are allowing the fully vaccinated to meet in larger groups, for example, in the Greater Seoul area that has been under level 4, the toughest tier of the social distancing scheme. Only 2 people can meet after 6 p.m., but if the gathering includes 4 fully vaccinated people, the cap could be expanded to 6 people.
Now, under this plan to gradually return to normalcy, the South Korean government is establishing a special committee on this issue. Tell us more about this committee. Who is on it and what are they tasked with doing?
So this committee is a special committee that will find ways to gradually return to normal by November, and normal as in living with COVID-19. By living, I mean resuming economic activity, education, and culture. And this committee is made up of a mix of government officials and civilians. Prime Minister Kim Boo-kyum is the chair, who will be joined by 40 cabinet-level officials from different ministries and civilians from various parts of the private sector. And the committee's first meeting is scheduled for 9 a.m. at the Central Government Complex.
It's good to hear they're starting right away. Now tell us, what are the major agenda items?
So a range of topics will be discussed during the 2-hour meeting, and the 4 main areas are the economy, education and culture, local governments, and the medical system. Now, many experts expect committee to discuss which social distancing restrictions should be eased first. They'll also take a look into whether a vaccine pass should be used, and if so, what the eligibility standards should be. Another topic is whether the government should continue to announce the number of new infections on a daily basis, as it has been doing so for a long time. Instead, they may decide to announce the number of patients who are in critical condition and the number of new deaths.
Yeah, I think that's a good idea, because you must remember that the vast majority of cases now are the Delta variant, and if people are partially or fully vaccinated, that often doesn't lead to them becoming seriously ill or dying. So perhaps having this big number every day is doing more harm than good psychologically to the nation's psyche.
Right.
However, that's in the committee's hands, not mine.
But regardless, I think most of us are thankful that we can gradually shift to normalcy from now on. Ye-eun, thank you so much for your report. We'll see you again tomorrow.
Thank you.
Thank you.